Talking about different ethnicities means that we have to face different anatomics and different concepts of beauty. For some people, beauty depends on volumes and shapes. So we have to inject to restore, increase volumes, and reshape the profiles. But for Asian ethnicities, the concept of beauty is strictly linked with the concept of youth. So we have to stick to adapt our knowledge and our skills to the different ethnicities and different requests of our patients. Looking at this young face of this man in his early 20s, we can appreciate, in first instance, the sharpness of the profile, the strong, important nose, a significant, powerful mid-face bones and muscles, a powerful chin, and the squared jaw lines. With the aging process, what happens? We have a significant loss of the bone structure, so we have a change both in ligaments and muscle structure that will dislocate from their original position. This involves that we will have a sagging, a ptosic descent of the soft tissues, both skin and muscles. So we have to try to restore volumes and profile, lifting all the mid-face and the lower part of the face. The face of this young Asian patient in his early 20s will be delighted by the delicacy of the shape. I mean that the smoothness of all the profile, with less evident bones and muscles, all the roundness of the shape, less volumes, and specifically for Asian ethnicity, we appreciate a more receded chin. This means that it's less prominent, a wider intercanthal width, a wider implant of the nose with wider nostrils, and a flattened malar area. With the aging process, what happens? That losing the soft tissues, I mean especially the fat tissue under the skin, we appreciate a descent of the tissues with increasing of the wrinkles, especially in the lower central part of the face and the perioral area. This means an important barcode, a very evident nasolabial fold, and very evident labiomental folds. We appreciated in all the patients we treat a slight improvement of the hollowed shape with natural fill of the virtual anatomical shape. The three-dimensional morphologic analysis demonstrates that volumization will be confined in the treated area, and we observed no product migration, a very little or no edema at all. Probably the high cohesivity of this product is the reason of this fantastic biointegration, and the pegylation is the reason of the great mechanical behavior of the filler in combination with the energy device injury due to the thermal effect. Here, in this three-dimensional imaging, we appreciate the location of the implant, which remains underlying the skin in its original position with no migration, with different volumes in reason of the area we treated and we injected and the needs. The Caucasian male face, we see after the treatment that we have to restore the profile because with the aging in the Caucasian male face, we have a blurring of the jawline, so increasing the volumes, especially of the third and the higher part of the zygomatic area, we can gain a very important lift of that part of the face, resulting in a well-defined jawline, which is very, very requested by men, of every ethnicity anyway. On the lower face and neck, the Caucasian male face demonstrated sagging and jowling due to skin laxity, but also to the reabsorption of the bone structure and the muscles, and dislocation and weakening of the ligaments. This resulting in blurring of the cervical mantle angle, which means aging of the face. The target of the correction is to inject the jawline and the zygomatic arch to repristinate and redesign the jawline and the zygomatic arch and to improve the lift of the face. In consideration of the sagging of the lateral part of the face and the volume loss of muscle and subcutaneous soft tissue, the restoring of the superficial lateral cheek, fat pad, induces a lifting effect of the whole lateral area. We can appreciate with this three-dimensional biometric analysis the implant under the skin in the mid part of the face that remains there. This is due to the high cohesivity of the product, which is very safe and predictable. Emphasizing and feeling the volume loss in this Asian girl in the area of the medial cheek fat pad was enough to achieve the goal and to emphasize a smooth transition between the palpebral malar area and the lateral soft. Remember that Asians do not like great volumes, so we have to avoid to inject great volumes in their face. Moreover, for Asian ethnicity, it's important to avoid this volumization of the lateral maxilla and zygoma, as we would consider in other ethnicities, in order to avoid further widening of the midface, which is very important usually in the aging of the Asian patients. Summarizing, this is a very interesting protocol that can fit both middle-aged men and women of every ethnicity worldwide. And lift is a simple, reproducible, safe, and effective treatment. It's very important to focus on safety of treatments nowadays that medical cosmetical procedure to gain, restore beauty and youthness is more and more requested to doctors. The main aim for a doctor is to preserve healthy of their patients. So using safe fillers and using the right device is the very first thing we have to think about when we face a patient asking his help to restore his beauty and youthness as well. Usually patients are totally satisfied with long-lasting and immediate result. Never forget that the immediate result is never the final result. Waiting for some weeks will help us a lot to gain and to reach the final goal. Thanks to the rheological features of Neauvia fillers, we can have excellent results using a very small amount of products. And at the same time, thanks to pegylation, we can easily combine these fillers with all the procedures using devices. Are they infrared procedures, ultrasound procedures, or radiofrequency, having a synergistic effect at the maximum level of this combination therapy.